The United States has the highest amount of coronavirus cases in the world, but it seemed like the virus was relatively late in reaching American shores. As places like Italy and Iran bore the brunt of the outbreak, many in the US were still debating whether there was cause for concern for them.
It's a virus, like the flu. It actually can be mistaken for the flu.
This virus still has the potential to erupt into a global pandemic.
American officials are still playing at the very low end of the kinds of interventions in daily life that may be tried at some point, that may be necessary to try to steer this pandemic.
35,000 people on average die each year from the flu. Did anyone know that? 35,000. That's a lot of people. It could go to 100,000, it could be 27,000. They say usually a minimum of 27 goes up to 100,000 people a year die. And so far, we have lost nobody to coronavirus in the United States. Nobody.
By mid-March, though, things started to look very different. Isolated cases became pockets of infected areas, and then came widespread pandemic. One of the world's most iconic cities in New York has become the new epicenter of COVID-19, and every part of life in the city is affected by the virus. There were early initial screening measures. A series of nationwide travel restrictions from infected nations like China and Iran were put in place.
As you know, China tried to say at one point, maybe they stopped now, that it was caused by American soldiers. That can't happen. It's not going to happen, not as long as I'm president.
We now know that the threat was actually coming from Europe, and while travel continued to places like Italy, New York became infected before anyone realized the extent of the problem. So on March 1st, the first case of COVID-19 was identified here in New York. A couple of days later, another confirmed case, a lawyer from New Rochelle, just north of New York City. 2 days after that, there were 11 cases in New York State. Many were people related to the lawyer.
Stand clear of the closing doors, please.
By March 6th, there were 33 cases. By now, people were starting to pay attention.
Everybody's very scared. They're trying to keep their distance from each other, but it's impossible.
Anxiety, depression, not much to do at home, just clean, sanitize everything, cook, stay home, a little bit of argument here and there with family members, but, you know, I'm having faith in God and praying every single day.
Supermarket shelves were being stripped off essential items as New Yorkers began panic buying. The people of this city have been through dark times in the past. The 9/11 attack on the World Trade Center in 2001 was the deadliest attack on the United States and killed 2,753 people of New York City. But only few thought that their city would go through worse. On March 7th, New York Governor Andrew Cuomo declared a state of emergency.
I have officially done a declaration of emergency, which gives us certain powers. We're going to be doing purchasing and hiring more staff, especially to help local housing authorities, local health departments that are very stressed.
Residents were told to avoid public transit. Social distancing was advised. And then, on March 11th, New York universities decided to move classes online. Then, public schools closed. By now, the number of cases was rising dramatically every day. And by mid-March, 3 people had died. By Friday, March 13th, 2020, social distancing was starting to be the new normal here. But it was still a puzzling situation. Little did the New Yorkers know that soon the death toll from the virus would surpass that of the September 11 attacks.
9/11 was nothing compared to this. We were open, waiting for patients to come who never came. Okay? Now, they just keep coming. And they're all ages. Don't delude yourself into thinking only the old will die or will get it. They're all ages.
With large-scale events before, but we haven't dealt with a sustained, serious call volume now going on its third week with no end in sight. Everything we're trying, pre-hospitally, we're giving our all. We're really, every EMT and paramedic in this city right now is giving more than they ever have. We haven't seen this. No one has seen this. But we know why we signed up for this, and it's to help.
As the pandemic spread, supplies of protective gear depleted. Vendors complained that orders from the city of New York were being slowed down by bureaucratic delays. Medical staff and police officers weren't being given sufficient protective gear. New York Mayor Bill de Blasio took up on the issue in mid-March. He pleaded for more masks from the federal stockpile, but that too had run dry.
Please, we need your help. We need supplies. We need medical personnel to come forward to volunteer. We will compensate them, but we need them to come forward and give us their time and energy where it's needed most. We need so much help. Obviously, we are the epicenter of this crisis. So I would certainly appeal to both the federal and state government to help us get the ventilators we need rapidly.
New York City's hospitals started to burst at the seams. Some of the doctors has described conditions as apocalyptic. Not enough beds for the sick, not enough ventilators to keep people alive.
As of this morning, they say we got 6 days left until we run out of ventilators. 6 days of people that if we don't get what we need, will die.
Emergency services began to buckle under the pressure. On March 26th, ambulance dispatchers received a record 7,000 calls for help. And the paramedics working on the front lines have had to make difficult decisions. Those most are sick prioritized and taken to hospital, but many have been left behind. The health system simply cannot cope.
There's been a lot of fear over supplies and whether we'll run out. And then obviously there's a fear that we will see patients and not be able to do everything we normally can to help save patients' lives.
Then there came a harsh reality. By the end of March, the death toll stood at over 1,000. 2 weeks later, that figure had increased by 9,000 people. Images emerged of a mass grave in New York City. Wooden coffins being stacked on top of each other at a burial site on Hart Island, where the city's poorest residents had been laid to rest. Hundreds of volunteers came forward to help morgues in the city. Funeral directors described the situation as a state of emergency.
We don't have the infrastructure to handle the amount of people that we're serving. We're way above capacity, as you guys could see. Maybe the government can help me and figure out a way that we can accommodate families in a timely manner and a more dignified way.
Those who die in hospitals cannot have family by their bedsides due to social distancing rules. The devastation of losing loved one is compounded by the terrible sorrow that they must die alone. Coronavirus has reminded us of another grim truth. COVID-19 has been killing Black and Latino people in New York City at twice the rate that is killing white people.
There are clear inequalities, clear disparities in how this disease is affecting the people of our city.
People from poorer backgrounds are more likely to have untreated health problems, making them vulnerable to the virus. It's also the case that there are more Black and Hispanic people are working on the front lines. Bus drivers, carers, shop assistants. They're out there every day, keeping things going. So for a second time, New York has become America's ground zero. While the city is the epicenter of the virus, it's been minorities and the society's most vulnerable who have been the worst affected. Coronavirus has hit this city harder than anywhere else. There are 27,000 people per square mile. It's the most densely populated place in the United States. So COVID-19 spread quickly. And what's been most concerning is the high mortality rate in New York. This city is a city that simply wasn't prepared for a pandemic of this nature. The virus has uncovered many inadequacies, such as an under-resourced health system and an acute inequality between rich and poor. But it is also bringing communities together. There is recognition for doctors, nurses, frontline workers who previously went unnoticed. The hope here in New York is that this city will rise up again, just as it's done in the past, this time with a deeper understanding for the many shortfalls that exist and with a greater desire to ensure that all New Yorkers have access to basic human needs.